In today's video, I'll be going over 5 commonly asked interview questions. Hello, welcome to Nursing with Professor B. My name is Bridget. I'm a family nurse practitioner. And my previous video on top 9 nursing interview questions has been seen over 30,000 times. You guys responded very well to it and it helped you out. So I decided to make 2 more videos. I've posted part 1 and this is video part 2. I also will make them into a playlist so that they're easier to find for you. If I forget to do the playlist, please leave a comment below and let me know that I haven't created the playlist. Let's dive right in. Another question that you might be asked is, name a time you had a disagreement with a coworker. Remember, it's important to always remain professional. You don't want to badmouth other people. An example of a time that there was a disagreement between a coworker and I, it was shift change. We had just had an in-service talking about how we should really be dissuading providers from ordering high-dose sliding scale because of the risk of hypoglycemia, and that they should be adjusting the Lantus dose versus putting patients on a high-dose sliding scale. We recently had just had an in-service on this, right? And a nurse had put a call to the provider because the patient's blood glucose was elevated. It was hovering above the 300s. So when the nurse got a call from the physician, I was standing right next to her. She did the whole S-bar and she recommended that the patient be put on a high-dose sliding scale. And I wouldn't say this in the interview, but personally I was shocked because this nurse was a veteran. She's been a nurse for many, many years. At the time I was younger, I was in my 20s, and she was double my age, if not more. I mean, she was in her 50s or 60s. So I was shocked that she was recommending this high-dose sliding scale when I heard it. Again, I wouldn't say that in the interview. I would just proceed with this part. I would say the patient's blood glucose was very elevated, but instead of recommending an increase in the Lantus, she recommended the high-dose sliding scale. When she got off the phone, I reminded her about the educational session that was held last week about not requesting the high-dose sliding scale because of the much higher risk of hypoglycemia with subsequent rebound to hyperglycemia. And in this situation, the provider had actually went with her recommendation and did order the high-dose sliding scale. So I wouldn't say that in the interview. I would continue going with that the more appropriate recommendation would be to recommend an increase in the Lantus dose because Lantus provides 24 hours of glucose control with no peaks. But what I had to do in that situation was I actually ended up having to call the provider back, and I didn't want to come off as a know-it-all. So I had to kind of I had to be like, oh, you know, it's hospital policy that we really shouldn't be ordering high-dose sliding scale. We just had an in-service with pharmacy this past week, and they want us to, the more appropriate intervention should be to adjust the Lantus dose. So again, the provider then canceled the other order, and then I did get the order for Lantus. But it was a headache. You know, when you're right in the middle of shift change, you have so much to do. So that was a time when I would say there was a disagreement, even though it wasn't like fighting. I wouldn't give an example of you getting into a huge altercation with someone. I would show you actually de-escalating a situation or acting very professionally, maturely. Another question that they may ask you is, tell me about a time you had a difficult patient. Now, you can answer this question one of 2 ways. You can answer it in regards to a difficult patient in regards to high acuity, or maybe the patient was rude. So depending on how you want to answer it. Okay, so in regards to, for example, high acuity, I would say there was one time when a patient was declining. She appeared irritable and her blood pressure was dropping. Additionally, on the ECG, she was developing severe bradycardia. I called the provider and requested labs because I felt that something was not right. When the labs came back, she was hyperkalemic. We treated the hyperkalemia, but I needed to find out what was causing her hyperkalemia. This patient did not have kidney disease. The patient was on TPN. So I kind of had like an epiphany, or maybe it was the Holy Spirit guiding me. Holy Spirit, activate. Because I was like, why is this patient's potassium so high? She doesn't have kidney issues. So the patient was on TPN, and I asked the pharmacist that was on my shift if she could just double check the TPN. And she did confirm that there was too much potassium in the TPN, that the previous pharmacist had actually made a mistake, which is awful. I know they should not be. I mean, you could kill a patient with too much potassium. So it appears the pharmacist on the previous shift had made an error and put too much potassium in the solution. The event was reported, And I would end it by saying like, it was definitely a feel-good moment where I felt like my intervention made a difference. So I wouldn't add all the extra details I just told you in regards to like, oh man, I feel so bad, they shouldn't have done that. I would just bam, 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 state the facts. Unfortunately, the previous pharmacist had made an error with the calculating the amount of potassium in the bag, and that is the reason. And I felt like my intervention made a difference. And then in regards to like like a difficult patient in regards to being aggressive, I worked in psych, so I could say something like, when I was working in psych, I had a patient that was very aggressive and easily angered. He had been to prison multiple times. I would know when he was starting to get agitated because he would start pacing in the day room. And I had been told that he had been in fights before in the unit and had hit other patients. I also knew that he liked to work out and do push-ups because when we had patio time, he would always go outside and do push-ups and just work out, and he really liked listening to music. So I used the therapeutic technique of making an observation, and I asked him, I'll just say, so and so, I noticed that you're pacing. And he said something along the lines of like, yeah, I'm mad. And then I offered if he would like to go out on the patio and talk about it. I did this in order to remove him from others, because a lot of times being around others, psych patients will feed off of each other, and then the energy in the day room escalates, and then a fight breaks loose. So I did this to take him away. I did it also to take away an audience. Sometimes, it's that showmanship, like, oh, look, I'm the alpha male here. So I took him away from others to calm him down. The tech and I went outside with him. I didn't go outside by myself with him. And we went out to the patio. We talked for a bit. We kind of just walked in circles and we talked. And then he would drop down to the cement and started doing push-ups. And I knew he could beat me in a push-up contest, but I knew how much he liked doing push-ups. So I asked if he would like to have a push-up contest. So of course he won, but he was happy because he beat me in the push-up contest. He started to feel better. He calmed down. We were able to go back inside, and there were no incidents with him the rest of the day. I didn't have to do an ETO, which is an emergency treatment order. So everything worked out that day. So that's an example of something that you could use if you work in the ED. Definitely, you're going to have plenty of stories of calming patients down. My hat off to you guys who work in the ED, paramedics, EMTs, hat off to you. Another question that you may get is, tell me about a time where you had to connect something from textbook to real life. Again, so this is going to be another like story time. I am going, in the interview, I would leave out all of these excess details. Like, I would not tell them this, but again, Holy Spirit activate. I was probably illuminated by the Holy Spirit. I was probably like guided by the Holy Spirit, because I was a fairly new nurse. Honestly, I don't know how I put this together, how I connected the dots, because this is a very rare situation. So when I worked in psych, I actually had a patient that developed neuroleptic malignant syndrome, which is a very rare but life-threatening condition. And it looks like they're having an exacerbation of psychosis. It's caused by antipsychotics. So the danger is, you think that this patient is just becoming more psychotic, and you give them a 5-250, which is the Haldol, Ativan, Benadryl, you're only going to make them worse, because you're giving them exactly what is causing their symptoms. It's almost like, how would I put this? It's almost like someone has low blood pressure and you give them some more blood pressure medication, you're going to drop their blood pressure even more. So that's the danger with neuroleptic malignant syndrome. So what I would answer in this question is, I had a time where a patient developed neuroleptic malignant syndrome. The patient started stripping, then he started running. It was like a little doorway that he started kind of bouncing off of, like parkour. He started running against the wall, bouncing off of it, and going against the other door. Then he started sweating profusely. This was a very young guy. He was in his 20s. He had been very psychotic, but calm. Not like this. Like, he was very psychotic in the terms of, he wasn't with it at all. Like, he didn't know what his name was. He thought he was like, he would go by the name of like some prince, like Prince, I'm Prince so-and-so. But he was never like this agitated. So when he started sweating and taking his clothes off, and I just knew something was off, something was not right. And it just hit me like, oh my gosh, this is just like neuroleptic malignant syndrome. And the intervention with that, when I worked in psych, we were just a psych facility. We did not do medical. So the intervention for him is call 911, send him out in an ambulance, right? If you're in the hospital, it's a little bit different. You do cooling, you cool the patient, you provide antipyretics, you lower the blood pressure, all that, but we don't do that. When I was working in psych at that time, this was a strictly acute care psych facility. By me recognizing neuroleptic malignant syndrome and not pushing even more medication into this patient, I did potentially save his life. Unfortunately, he never came back to us, so I don't know. A lot of times when we send patients out, they would come back, but the hospital probably kept him, and then the hospital also has a psych facility, so they probably just sent him to their psych facility for further monitoring. Again, we had to have patients that were strictly psych. We couldn't have patients that had too many medical things going on because our psych facility wouldn't accept them. So that being said, he didn't come back, so I don't know what the outcome was. And then the last question I will cover today is, why should we hire you? You want to use keywords that are in their job description. So for example, if the job description says that they're looking for someone that's responsible, compassionate, someone who is adaptable and flexible, hit all those keywords. Say, I am compassionate, I'm able to learn and adapt quickly to my environment. I'm a Christian and I want to extend the healing ministry of Christ. I believe in that mission statement and it aligns with my morals, and I think it's beautiful where you can work at a place that you can pray with patients and that it's okay. You can say something along the lines of, I'm hardworking, I'm caring, I'm compassionate, I'm empathic, I'm adaptable, flexible, team player. So I wouldn't hit all these words. I'm just giving you a lot of keywords that you want to say so that you can pick 2 or 3 from. Those are all things that you can say when they ask, why should we hire you? Highlight your positives, but of course, be humble about it. You don't want to sound narcissistic, basically, is what I'm saying. The 5th question is, why did you choose our hospital or our company? And employers love to see that you took the time to look up their company. So make sure that you do your research on the organization. So I said for Advent Health, you can mention the whole extending the healing ministry of Christ. If they're a magnet hospital, you can say, I really admire the fact that your hospital is a magnet hospital. I know that there's a lot of rigorous research that goes into that and preparation. You could say, because this is a level 1 trauma hospital and I want to challenge myself and learn more. You could say, because your values align with my values. So again, do your research on the company and who founded it, why they founded it, what's their mission statement, what drives the company. Now that I'm a nurse practitioner, and I'm looking into telemedicine, if I'm interviewing for like a telehealth company, and they're super like technological, I could say like the marriage between healthcare and technology really appeals to me. The fact that technology is enhancing the healthcare that we're able to bring to people. If you work in a rural hospital, you could say, I'm passionate about bringing care to underserved areas, etc. So those are some common questions. Make sure that you hit the like button, make sure you subscribe, make sure you turn on that notification bell, leave a comment below if you had one of these questions in your interviews. If you had a different one, drop it below, let me know, and we can help other people. Thank you so much for watching. Until next time.